back maybe 30 years before in China, you being a Chinese, what made you to make the decision to study Western medicine?
At that time, when I was in the medical school, the Chinese medicine, let me see, there was medical university of TCM, traditional Chinese medicine, but it wasn't popular.
So from where you begin to do research on Chinese medicine? You told me of your fellowship in USA in Health Institute of
the National Institute of Health.
Yes.
That's an interesting place, but I didn't do any TCM there. At that time, we tried to understand all the genetic alterations in cancer, and we think once we found those genes responsible for cancer, for example, then we will find cure.
Okay.
And then I think also we followed up, and we tried to find, for example, small molecular weight inhibitors or antibodies, try to block those oncogenic pathways. But gradually we actually realized that it's not as simple as that. For example, in cancer, there are so many pathways which are altered in cancer. Now, you imagine if you use one inhibitor or antibody to block one pathways, and the other pathways can compensate for the loss of that pathway. So then you say, okay, I'm going to block another pathway, and there are others to compensate. So actually, in a way, back to your original question, and that's the reason why I and including others, think it is time now to think about the value of TCM. We see the problem in Western medicine, and we think that TCM can not replace it, but can as a complementary medicine to fill in some of the vacuums existed in the Western medicine.
In your talk, I specifically hear that in Western medicine, there's one thing actually do not have solution, which is that for the cancer patient, once their cancer has been cured, right? But how to prevent that for recurrence?
Right.
And you see the value of Chinese medicine on that. Can you elaborate a bit more on that?
Sure. Actually, it's interesting you touch on the question, or actually an important point, which to me is another reason to consider TCM. Because these people, as you just mentioned, we call cancer survivors. So the disease is in remission. So these people, in a way, just like us, they walk on the street, they are working. So in a way, they are healthy. So to prevent cancer recurrence in these people, a big population actually, it's a big population, just based on the American Association for Cancer Research report in 2011, the number of cancer survivors in USA alone, 12 millions.
Wow.
12 millions.
Yeah, that's a big number.
So to think about some agents or device for this big population of people for long-term use to prevent cancer recurrence has to be not only effective, but also low costs, as well as no toxicity or very low toxicity. So I think that's another value to consider the TCM. Now, I don't mean TCM will have no side effect because it has been used for thousands of years. That's not a good reasoning to say no toxicity. But I think it's because it's a mixture of the chemicals rather than single chemicals. So often there are some synergistic effect. So because of this synergistic effect, which may not only increase the efficacy and also decrease the side effect. So I think that's, to me, another reason to consider TCM in the effort to develop a prevention strategy for cancer survivors to prevent cancer recurrence.
What you see in terms of the trend, say 10 years down the road, 20 years down the road, what will be the trend for the cancer treatment, specifically when we talk about the integration of Chinese medicine and Western medicine?
The Western medicine play a very important role in terms of improve the people's life qualities and the longevities. If the TCM can play its role in terms of say in cancer prevention, in terms of decreasing the side effect of the Western medicines, and to sensitize cancer cells to Western medicines, if they can play that role, and I do believe the TCM can play that role, and that actually is a very important contribution. Yeah. Again, it's not one replace another. It is a complementary process.